Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Relazio Menard. It's estimated about 2.2 million adults in the U.S. live with obsessive compulsive disorder, or OCD. It's a condition where compulsive, unwanted thoughts and behaviors impact a person's daily activities and can significantly impair quality of life. About 35% of OCD patients do not respond to medications for depression and OCD. But now there's a non-invasive in-office procedure called Transcranial magnetic stimulation, or TMS, helping many OCD patients reclaim their life. So today we're talking about TMS therapy for OCD and depression with Dr. Umer Najib, Director of the Transcranial Magnetic Stimulation Program at the WVU Rockefeller Neuroscience Institute. Welcome, Dr. Najib, to Live Healthy West Virginia.
Thank you, Mary, and thank you for having me here.
It's great to have you here. So I know I just talked a little bit about what OCD is, but I want to hear it from the expert. Explain to us exactly what OCD is.
So obsessive compulsive disorder, or OCD, this is a long-term condition that causes people to experience recurring unwanted thoughts or impulses known as obsessions. And individuals with OCD then engage in repetitive behaviors known as compulsions to get rid of these obsessions. Most patients with OCD experience both obsessions and compulsions. Now, obsessions can be highly variable. Obsessions can be a thought that is odd. For instance, harm will come if the closet is not arranged in a certain way. Or they can be distressing mental images. Now, regardless of what the obsession is, these are usually significantly distressing. And individuals with OCD, they try to either ignore these obsessions or suppress these obsessions, often by doing other behaviors that can become a ritual or compulsions. Compulsions can be observable, such as repetitive hand washing or double checking the locks, or they can be purely mental, such as mental calculations or mental recitation of a phrase, for instance. As you pointed out, we have millions of individuals that have OCD, and some data suggests that up to about a third of adults experience some OCD symptoms, but about 2 to 3% of adults have enough symptoms that they qualify for the diagnosis of OCD.
Okay. So that sounds like it's very disruptive to just your daily life, right?
Absolutely. It's extremely disruptive. And unfortunately, up until a few years ago, when TMS came along, we did not have any great treatments for this condition. The traditional medications that have been used to treat OCD, long-term data suggests that up to 80% of patients, so 8 in 10 patients, continue to have some degree of symptoms even on those medications.
Even on the medications. So now I know, because we said we're here to talk about TMS therapy, and this is an FDA-approved option for managing OCD. So how exactly does TMS therapy work?
TMS therapy is, as you mentioned, non-invasive. This is focused, individualized therapy using magnetic pulses. These are bursts of magnetic energy or pulses of magnetic energy that go across the skull, hence transcranial. And as these pulses of magnetic energy cross the skull, they stimulate the nerve cells in the brain that are called the neurons. In OCD and in certain other conditions where we use TMS, for instance, depression, certain parts of the brain are hypoactive, meaning that the nerve cells are not working, are not as active as they should be, and particular areas of the brain are working less than they should be. They're not as active. And using TMS, we can target specifically those areas of the brain and increase the activity of that particular area of the brain. So for instance, for OCD, imaging studies have shown that certain parts of the brain are involved, and one of those parts is less active than it should be. So using TMS, we can target that part of the brain and stimulate it, increase the activity, normalize the activity of that part of the brain, and that results in improvement of the symptoms.
So if you're having like obsessive thoughts, this treatment will make those thoughts, make you stop having those thoughts?
That is correct. So the thought is that the obsessive thoughts then lead to compulsions, and this treatment decreases the incidence of those thoughts and improves the clinical symptoms by decreasing or suppressing those obsessive thoughts.
And how do you get these to cross the skull? Because this is incisionless, right? We're not...
Correct. This is completely non-invasive. Magnetic pulses can cross through the skull and water and air and other tissue. And this is where this is a fascinating technology where these magnetic pulses, these bursts of magnetic energy can go through the skull and precisely target a part of the brain that we want to stimulate and increase the activity of that part of the brain that normalizes the whole circuit that's not working properly.
Okay. So what can a patient expect during a typical TMS therapy session?
So as I mentioned, this is individualized therapy. So the first session, when the patient comes for the first visit, is when we establish the treatment protocol. And there are a couple of things that are unique to every patient. Every patient's brain is a little bit different. So we determine where that target area in that particular patient is. For instance, patients who have OCD, there's a part of the brain called medial dorsal cortex.
Okay.
It's a fancy name. It's just a part of the brain that's involved in a particular area.
Okay.
Medial prefrontal cortex. That's the particular part of the brain. But that particular part of the brain will be a little bit, there's a variation in exactly where it is in everyone's brain. So we figure out where the medial prefrontal cortex is for that given patient.
Okay.
And then the dose of the magnetic energy that is needed to get to a patient's brain will be different in each patient.
Oh.
It mainly depends on the thickness of the skull. So we determine the dose that we need to get to the patient's brain. So we create the protocol that is individualized to a given patient, and that takes an additional time, but that is on the first visit.
Okay.
So in the first visit, the patient goes through this process where we determine the protocol, the dose needed, the exact target location, and then the subsequent visits we have that information for the subsequent visits. So the subsequent visits are shorter. Mm-hmm. As the patient comes for the subsequent visits, they get the treatment straight away.
Okay. So how many sessions would you need to, accomplish what you're trying to accomplish with this?
The duration of these treatments, individual treatments, let's start with that.
Okay.
The first, as I mentioned, the first treatment involves establishing the protocol. That can take anywhere from an hour and a half to 2 hours, whereas the subsequent treatments are typically 30 to 45 minutes.
Okay.
The studies have shown that patients require, or patients start to notice a clinical change anywhere between 2 weeks of treatment to 6 weeks of treatment. And therefore, the FDA approved the standard protocol is a total of 29 treatments. That corresponds to about 6 weeks. Treatments are done Monday through Friday, so it's a daily treatment. Once a day, daily treatment, Monday through Friday, over a period of 6 weeks for a total of 29 treatments.
Okay.
And as I mentioned, in clinical practice, we see patients start to notice a change as early as after 2 weeks of therapy, so about 10 treatments. It can be as late as 5 to 6 weeks of therapy.
Okay.
As the patients who get better, the duration of the response is highly variable. Some patients can go into remission where they do not have symptoms, while most of the patients require some degree of maintenance therapy long term. And again, that is highly variable as well because everyone's brain's different and it responds to treatments differently. For some patients, and even here, the treatment is very individualized.
Yeah.
Depending on the patient's response, depending on a lot of other factors, how far they live, what kind of job they have.
Yeah.
We create a personalized treatment plan for the patients. And if they require maintenance therapy, the maintenance therapy can range anywhere from 1 treatment a week or a few treatments every 3 months. And it's highly individualized based on their response, their other medical problems, the social determinants, how far they live, their access to care.
Sure.
But majority of patients require some degree of maintenance therapy down the road.
Are there cases where once you complete the 6 weeks of sessions that you don't have to go back again?
Yes, absolutely. That data for OCD, since this is a new treatment, we don't have enough of that data. Overall, we know from long-term pharmacological studies that patients who improve, about 20% of the patients go into remission, meaning that they don't have the symptoms anymore. But with TMS, we don't have that long-term data yet. But our expectations would be similar. We do have better data for patients who have treatment-resistant depression.
Right.
And in depression patients, we see that patients who respond to the first 6 weeks of treatment, about 1/3 of those patients go into remission, meaning that their symptoms do not reoccur for years and years later.
Wow, that's great. I think it's important to point out too, like how do you transmit these magnetic waves? I mean, is the patient wearing a cap, or are you waving a wand, or how does that work?
Right. The machine or the equipment, it's a large piece of equipment that generates the magnetic pulses, but the patients only come into contact with a part of that equipment, and it's like a pedal or a wand, as you mentioned. If patients look up TMS, Google it, they'll read a term coil, and that is because there's a copper coil inside that piece, and and for the lack of imagination, we just call it a coil.
Yeah.
But that coil or pedal, it comes into contact with the patient's head, and that's how the magnetic pulses are transmitted through the skull. So patients are seated in a comfortable chair. We make sure that the patient is comfortable during the procedure. The pedal comes into contact. It's the contact itself is not uncomfortable, and that's how the magnetic pulses are transmitted to the brain.
And I think we should let people know, now this isn't like an X-ray. They shouldn't worry about radiation exposure.
Correct. This is not X-ray. This is a magnetic pulse, an invisible magnetic pulse that crosses the skull and does not cause any damage to the brain tissue or any other tissue.
Okay, good to know. All right. So what are the main benefits of TMS therapy for OCD?
The number one benefit is that this is a very focused and individualized treatment. The treatment is targeted at a particular part of the brain that is involved in OCD. In depression patients, it's a different part of the brain that we target, but this treatment targets the part of the brain that's involved in that condition, and it improves the activity or the function of that part of the brain. And so therefore, the patients do not have the common side effects that they may have with medications. As you would know, a lot of medications can cause GI side effects and can cause rare cardiac side effects and so on. And with TMS, there are no systemic side effects. Even the medications that are used for the treatment of OCD or depression, these medications target the whole brain. They're not focused treatments, and can again cause neurological side effects like cognitive slowing, some drowsiness, sedation, sleep disturbances. TMS does not affect the rest of the brain. It's very focused. It's targeted to the area that is not working properly, and increases the activity of that particular part of the brain, and does not cause any side effects for the rest of the brain.
Excellent. All right. So then what are the risks, or are there any side effects to TMS therapy?
The most common side effects are discomfort in the head that can sometimes cause a headache after the treatment.
Okay.
The magnetic pulse, the pulse of magnetic energy as it crosses the skull, on the skull, it feels like a tap on the skull.
Okay.
And for some patients, we need a higher dose to get through the skull. And
if you have a thicker skull,
right? and that can sometimes cause some discomfort on the scalp,
okay.
And that is the most common side effect: the head discomfort or a headache. Some other rare side effects include neck discomfort because of this part coming in contact with the head, or ringing in the ears. We obviously take precautions, provide neck brace, provide earplugs to the patients. Other than that, it's an extremely safe treatment.
That's great. That's great. So who's considered to be a good candidate for TMS therapy?
Patients who have depression or OCD, and they have failed at least 2 medications, pharmacological treatment, or have had side effects to at least 2 medications. Okay. They may qualify for this treatment. Now, the approval, the insurance coverage is highly variable. For OCD, usually it's the failure of 2 medications, because unfortunately we don't have a lot of treatments for OCD.
Yeah.
For depression, some insurance companies require a failure of 3 or sometimes 4 oral medications before they would approve TMS. But this is a good option for patients who are not able to tolerate medications, or who do not respond to the first line oral medications, and have failed at least 2 of those therapies.
They have some hope. There's an alternative treatment.
Absolutely.
That's great. So you said, I was going to ask you, do most insurance companies cover this? But it sounds like it just depends on what your insurance company is.
Right. No, they may have a different criteria for coverage, but most insurance companies cover this treatment.
Okay.
Almost all insurance companies cover it for depression, and most insurance companies now cover it for OCD as well.
Okay. So what is the success rate for TMS therapy for OCD? And while we're talking about depression.
Yeah. So for OCD, the clinical trials have shown that up to 60% of the patients, so 6 out of 10 patients, have some improvement, and more than 4 out of 10 patients have a significant improvement with TMS. These numbers are actually far better as compared to the medication treatment. So this is exciting news for patients with OCD. For depression, on the other hand, again, our experience is similar. 60 to 70% of the patients have a significant improvement with TMS. And as I mentioned, about 1/3 of those patients actually have remission in their symptoms with TMS. So these are some excellent results that the clinical studies provide us.
Yeah, and again, giving patients hope. We have been talking about the fact that TMS therapy, you started using it with depression first. So
Correct.
Does TMS work any differently if you're treating for depression, or is it the same, basically 6 weeks, or is there a difference?
The practical aspects are very similar. The concepts of the treatment are similar. We are using magnetic pulses to increase the activity of the brain that's involved in that problem. And as you mentioned, the standard practice is again 6 weeks of initial therapy, and then depending on the response, we create a personalized treatment regimen for the patients. But the target areas are different. because the part of the brain that's involved in depression is a different part of the brain as compared to the parts of the brain that are involved in OCD. So we target different areas, we target them a little differently, but the basic principles of the treatment are similar.
Okay, so we're already treating depression with TMS and now OCD. Are there any other conditions that you use TMS for treatment, or maybe some that are on the horizon here in the future?
So I'm very pleased to report that we are at the Rockefeller Neuroscience Institute. Our TMS program is actually one of the handful programs in the country that offers this treatment as an off-label treatment for several other conditions as well, such as chronic pain and in stroke recovery. For these other problems, that this requires a very high degree of expertise, because there's no standard treatment protocol for these problems. But people of West Virginia are very lucky that at the Rockefeller Neuroscience Institute, we have an excellent team of neurologists and psychiatrists, along with trained TMS nurses and technicians. And this is the only comprehensive TMS program in the state that can use this technology as an off-label treatment for patients who have refractory chronic pain, who are struggling with stroke rehabilitation, and even select patients with chronic tinnitus or ringing in the ears as well.
And let's stop for a minute here and talk about the WVU Rockefeller Neuroscience Institute. I mean, the depth of expertise. I mean, this is a big deal that we have this place right here in our front yard in West Virginia.
Absolutely. Some of the things that we have been doing in the past few years, we are the first in the nation and even the first in the world for some of the neuroscience achievements that we have been able to showcase. And this is another example. Our TMS program is one of the very few in the country that is a multidisciplinary program. We have experts like Dr. Jordan Aroman, my colleague in this program, who's an expert in treatment-resistant depression, treatment-resistant OCD. We have other psychiatrists working with us. We have neurologists, neurosurgeons, trained nurses and technicians, and this is a truly multidisciplinary program where each incoming patient is evaluated by different experts. An individualized treatment plan is created for those patients, and we have had amazing success stories from hundreds of patients that we have treated now.
Excellent. So before we go, tell me what's the most important thing you want our viewers to know about TMS therapy, be it OCD for depression or off-label. What's the most important thing we need to know?
The most important thing is that the TMS therapy is a safe, effective, non-pharmacological, and non-invasive neuromodulation treatment, especially for depression and OCD. Any patient with depression or OCD who has either failed 2 oral drugs or has had side effects to at least 2 oral drugs should talk to their provider about this treatment option. Any patient with depression or OCD, if they go online and Google RNI and TMS, they'll be taken straight to Rockefeller Neuroscience Institute TMS program website that provides further information about this treatment. And they even have the option to request a consultation directly from the website as well.
Okay, so they don't need a referral from their provider, their PCP.
Right. They do not. They can request a direct consultation, and our team will reach out to their providers, gather all the information, and then go on from there.
All right, great. Thank you so much for sharing this information with us. You guys are always doing really exciting things over at the Neuroscience Institute. It's always interesting. So thank you for sharing this information.
Thank you for having me here. It was a pleasure.
All right, great. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about TMS therapy, visit wvumedicine.org/TMS. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the all-new Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Najib and everyone at WVU Medicine, thanks for joining us.